Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And we're back, and we're moving into our first conversation for this morning. This is your COVID-19 update, and today we are discussing testing. We've heard quite a bit about testing being done locally, but we're taking a much broader perspective as to what is available, what are some of the tests that are proving to be accurate or helpful in minimizing or containing COVID-19 cases. So here to have this conversation with us, or I should say joining us via the internet, we have Dr. Fernando Cuellar, who is from the Belize Medical Associates. Good morning.
Hi, good morning, guys.
Good morning, Doc.
And once again, thanks for having me.
Yeah, well, we appreciate you taking the time this morning. And this is such an important topic for us to be having at this time, because we know today makes 3 weeks with no new cases of COVID-19. What are your thoughts on that?
Well, of course, my immediate response to that is we are grateful, we are thankful, we are happy that we are now 3 weeks without a confirmed case of COVID. I would like to say, for whatever it's worth, maybe divine intervention, we are blessed with a God picnic, and those who don't believe in God and divine intervention, the forces of nature are looking positively on us. Whatever explanation you can put in there, let's put it in there, alongside, of course, with the efforts that the country has made, and particularly the Belizean public, because I'm pretty impressed and happy on the overall Belizean public, although if you listen to your segment before, we had X amount being arrested for the infringement, but by and large, I think our Belizean public have adhered to the sometimes railing up for the suggestions, recommendations, the ever-changing SIs, but overall our Belizean public have behaved quite nicely, behaved quite responsibly in following the guidelines.
Right. No, I agree with you. And I think that it is important for us to underscore as well that while we're talking about relaxed measures, we do need to keep up our part or responsibility in maintaining the social distance and the proper hygiene practices alongside whatever relaxed restrictions may happen.
Of course, Marlene, because if we don't, we're going to lose everything that we've gained so far.
Yeah.
We're going back way like crab. Okay, we've gained so much, but
we
if
can't
we
afford
do
to.
that it's time to let up or time to say it's all over, then definitely we'll have trouble in the near future again, and maybe even worse. So please let everybody understand that this isn't the end. This is mostly half time. You know, like when you got a football game to go on, this is a half time. With the drink really water with the rest, and then we come back for second half.
Yeah. I think that's an accurate way of putting it, because we've heard, not just in Belize, but across the world, about concerns and the need for preparation of what is called a second wave. And one of the things we know that we are looking at is what will be our testing protocol moving forward. So Dr. Manzanero said last week, the Director of Health Services, that they weren't getting so many calls of people saying that they had symptoms associated with COVID-19 and requesting to be tested. So they moved from that to broadening their testing base, and in fact would start random testing for frontline workers. You know, when we look at the situation, we're at over 1,000 tests, closer to maybe 1,100, and we know that is barely even, not even 1% of the population. What are your thoughts on how much we've tested so far?
Well, definitely without any confusion, we have done too little tests so far.
Okay.
Okay, we are far below the amount of testing we should be doing for X, Y, and Z reasons. And I've said it in another interview that sometimes when I hear Dr. Manzanero and ask the experts explain, it gets confusing. We don't know why the testings are not done. Sometimes we hear we have amount of kits, but we don't have the reagents or we don't have the swabs.
Yeah.
So I would hope the message delivery is a little bit better, because most people are confused when they hear one day we have X amount, next day we don't have, et cetera, et cetera. But for sure, the amount of testing so far is far below the amount that we should have had by now, and hopefully, all the different factors come into play so that we can increase our testing, so that we can have a realistic view of what's going on. Because first we were testing people who were highly suspicious of COVID, who had flu-like symptoms, who had respiratory ailments, and then we had the confirmed cases. We did the contact tracing, and by the way, I always want to big up our real frontline people who do these things, who do the checking and the testing. Those are the real people we need to say kudos to. So we did the contact tracing, and we followed, and we even found 2 clusters, one in Cayo, one in Belize. We did the cases in San Pedro. But I think now it's high time that we expand our testing to the other type of frontline workers who are more in masses. Say, for example, the custom department, immigration, police, the healthcare workers, as part of the increased testing.
Yeah.
Let me
I
ask
also need to say that I heard in the Senate meeting, the AG say that it was using Donald Trump's word that it was a hoax about the media talking about increased testing, because he based his evidence on a New Jersey experience with one of his family members. And I think that was not the proper thing to say. Okay? I think the US perhaps, and I'm sure that 75% of people would agree with me that the US model of handling COVID-19 isn't the best model ever to even start.
Yeah, that's true.
Okay?
Agreed.
So we definitely can't say those things in big settings like the Senate, where we say that this is just a hoax, or the media is just hyping up. Medically speaking, scientifically speaking, we need to do further testing.
Let me ask you this then. We're looking at now moving to random testing, simply because it has been put forward that we cannot possibly test each and every citizen of this country. So now we're looking at a random sample. What is your take on that? Considering the fact that we're already below where we ought to be.
We need to do random, and I need to hopefully explain what random means.
Yes.
First, we were doing, I don't know what's the proper word, directed testing for the flu-like symptoms for people who are sick.
Yes.
Now we need to expand to people who don't even have one single symptom. And I would first suggest that we do it to the people who are in contact with masses, the customs, the immigration, the police, the healthcare workers. That means that, okay, say we go to the custom department, and how much people you have? 200. Okay, we select one number, and there's always a mathematical way to do it more specifically.
Yeah.
But just on the top of my head, out of the 200, we're going to test 75. And we're going to test the one who worked on the shift yesterday, or the ones who worked 2 days ago. So that's the randomness of it. We don't select people who are sick. We just go, let me give a list of the customs officer. We're going to swab them. We're going to test them. And the same thing with the police, who have been on the front line, the checkpoints, doing the night rounds. And of course, more importantly, the people who are working in the hospitals, the people who are doing the swabbing. And I'm thinking, and I know my colleagues at Ministry of Health are also more than likely thinking along the same lines, that we're going to expand our testing to that group of people, and to even get more random test the community at large.
Yeah.
The checkpoints are there. or we can go to Brody's or Seaview and test the employees. We could go to Channel 5 and select one anchor person out of the 4 or 5 that you have. In other words, those are the amount of testing that we need to do. And you did something very, very important, that you can't expect to test how much Belizeans we have within our boundaries, 400,000?
Yeah,
We can't.
410.
It wouldn't be cost effective. It wouldn't make sense to do all of that. But maybe a third of the population, there are mathematical models can tell us what would be the correct number of testing that we should do. And maybe we can't come close to it because we are strapped for money, we are strapped for resources, but we can come close to that. And I'm hoping that my medical colleagues are telling the people who are in charge, the oversight committee, the leader of the opposition, the prime minister, the attorney general, everybody, that we need to increase our testing. We need to spend so that we have a realistic view. Because God forbid we have an asymptomatic carrier that is not identified, and then things can blow out of proportion, of course.
So in that context,
this is why the random testing is critical, because we can have, and you can correct me if this is a false scenario, but from my mind, we can have asymptomatic carriers right now in this country, and they can be passing on to other people who are also asymptomatic. But it's until it reaches a point where we start to have critical patients, that's when we'll realize that it has been continuously spreading.
Of course, that's the point we have, and there's a lot of science behind that. I have a number of papers that would say that you are shedding virus even before your symptoms, meaning that you're the leg of the virus, the virus in you, and you could spread it. And some papers are even saying a day or two before your symptoms appear, you shed the most virus. So there's still a lot of uncertainty, but the general consensus is that you can shed the virus, you can spread the disease even before your symptoms start. Hence the reason for the random testing will be needed. And we need to spend finally extra money for bringing the amount of testing kits and to do that.
What are your thoughts in this particular context then on rapid testing? Because a lot of people, or should I say there is a number of persons who are of the impression that perhaps going the route of rapid testing would be able to allow us to get a clearer picture quicker. But there seems to be questions in terms of the accuracy and all that other stuff. What are your thoughts?
Well, no test is accurate for anything. No test. We don't have 100% specificity, meaning that each time you do a test and the person have the disease, it can show positive. But definitely the PCR that we do here in Belize is still the gold standard. That are the tests where they do all over the world, where we come as close to say whether a person have the disease or not. So those who would argue against me to say that it's not specific enough, it has, some papers would say 15% false negative or false positive or up to 30, then what do? We just fold our hands, we allow next 2-3 years to pass, and hopefully we get this famous the herd immunity, because by then 2-3 years time, then we have it as a herd. No? It will be here amongst us. Who knows even, because I could come to argue that and say we don't know much about this virus.
Well, I was going to ask that question, because I hear people talking about herd immunity, and it essentially means that enough of us get it, or body learns to fight it, and you don't can't see the type of devastation that we're seeing right now. That's essentially what it means, right?
That's exactly what it means, that if you leave it, we cross our hands, we go about like nothing happened. If 70 people dead, well, so be it. If 150 dead, then so be it. We could care that they died in the name of science to make everybody in Belize get immunity. But one of the enigmas, one of the questions that we have, we don't know about this virus, so we don't know. We don't know that if indeed it can behave like other diseases where you develop immunity, and for how long.
Yeah. And as a matter of fact, it seems to be that the data is saying that people can be reinfected. Again, a lot of the COVID-19 data is just preliminary, but the preliminary science is showing that people can most likely be reinfected.
Well, yes, that's true. But again, it's far too early, Marilyn. It's 4 months. It's a new disease. It's a new virus. I was going to say that if we would compare to HIV and the scare that we had in the 80s, we can now concretely say that once you catch HIV, and catch HIV again, you don't get it, you don't get it for life, but medication will help you keep it to a minimum and allow you to have a regular lifestyle. But we know because of it's what 40 years now, 30 years, HIV, we know about it, but this is a novel virus, a new thing, we don't know about it. So let us perhaps err on the side of caution, okay, until more could be understand from it. And I already want to add the thing about the vaccine.
Yes.
The earth, I think, the reliable or the believable experts, because, they got experts like Mr. Trump, and they got experts like Mr. Fauci. Who would you want to believe? I'd want to believe Dr. Fauci, of course. He would say that the vaccines might come available at the end of the year or early next year, but by the time you reach Belize, believe you me, be another year from that, because the bigger countries want to buy the most vaccine, and we talk about billions of vaccines. So we really look at being able to purchase vaccine either directly or through or PAHO. We know they get it to at least 6 months after, 1 year after it's become available.
And we have the H1N1 experience to be able to use as a guideline for that. Because in fact, when the H1N1 vaccine came out, it was 2 years after we first detected the virus that we in Belize had access to that vaccine. And that is a very critical point to be able to share.
One of the I would invite people to read about is the 1918 flu pandemic.
Yes.
That affected the world. That comes as close as it has come to what we are facing right now. Exactly the same. Imagine what our technology was in 1918, what was the level of medicine was, and they faced this new virus, the flu virus, and they went through the same things. I saw pictures of the masks being implemented back then, the almost to the T, the exact same things.
Yeah, they had lockdowns too.
Lockdowns too.
Yeah.
Everything that you read those articles, it's like deja vu all over again.
Yeah.
We have to learn that. That also came back with that terrible second wave, which was even worse than the first wave. So that is why the great physicians like Fauci and Birx and all of these people who are there, they look at these data from back then and are learning, and we should also do that to understand better what's going on.
So this is such a critical time. You called it halftime. I guess in Belize we could use it like the eye of the storm. There's potentially the stronger winds coming after the storm, and it's so critical for us to prepare.
I was trying to compare it to a football match or a soccer match where they halftime, but we need to gear up for the stronger second half, no? But we cannot let our guard down. We have to be as resilient and do the things that are being exactly what you were saying in the first segments, self-distancing, 6 feet or 6 foot, whatever how you want to call it, that is. The face mask, I think it was a wise thing to mandate. But we also need to hurry to say that we need to have an educational campaign to show people how to use masks properly.
That's true.
It's not just putting something over your face and then they touch up your face, like I saw in the House of Representatives the other day, no?
And we've done it on the show a few times, but I think maybe we were ahead of the time.
You see that Washan program that the kids did? I mean, that was great. I think we need to do something like that for masks. The only thing I would say there that my 2 cents in this, and I know they hit me back and say, stay in my lane because I'm not a law person, but the penalty there should be more community service. If they catch you, they charge you, they carry a court, they find you guilty. But they're not telling them to pay $5,000. Poor people ain't got money for eat right now. You give them another stress for $5,000. So when this thing done, you do community service for 6 months. You're going to the prison or the hospital or clean the street. And then I think will be much more effective as a payback
Ironically,
That's it.
someone brought that to my attention over the weekend as well, that the penalty may be too stringent at a time when persons can't really afford food or other
Basic
financial or basic needs. And so the $5,000, I don't know, it's
Yeah.
kind of stiff.
Yeah, they need to be more creative and make the penalties a little bit different than just the cash part. I do agree with I mean, I don't want to sound bad on TV, but I can't call it less than idiots who they try cross the border.
Yeah.
Because I sit there with one toilet paper, but I know like you can't get toilet paper at Belize.
Yeah.
Yeah,
Yeah.
yeah.
So
Soap and
I
that
mean,
sort of stuff.
Yeah, it was an incredibly selfish
I
act.
say, okay, like one week when we catch there, we do quarantine at 2 hours. We set up one thing and judge will find them guilty and send them straight to jail. Make them do community work in jail. They find them. Send them to jail for 3 months, make them learn, and make other people learn that they know for do that nonsense. Because if they do that and they bring back something out of these, we gone back to square one.
Yep.
Yeah. No,
This would be all for nothing if that were the case.
and all of us who are trying to stick to the rules and to be able to practice what the guidelines are would be doing it for nothing if people continue with that type of behavior. But let me go back to the testing idea. So if we are able to achieve, and you said very clearly that the tests that we're using, which are from the WHO and PAHO, are really the gold standard. They're the best tests that we can be using to have the most accurate picture as to whether or not someone is positive. But what about things like the antibody test? Is that also something that we should perhaps be considering?
Yes. A couple things there.
Yeah.
They're trying to develop what are called rapid tests for the virus itself, the antigen, the piece of the virus. They're trying to do that so that we can test at point of care. You go to my office, you go to the emergency room, then take the blood, and in a couple of hours, then see if you got the virus. That none has been approved as yet.
Yeah.
That's a different thing from tests for antibodies.
Yes.
Now, I think the use of the antibodies would be very more useful in deciding how we manage reopening our country.
Okay.
Yeah.
Okay, right? So if we have to plan properly at the airports, at the borders, and say anybody who want to come in need to get one antibody test. Okay, and probably take, I don't know, 12 hours, 6 hours, 18 hours to get the results. And if you have antibodies, then you come in or not come in. But that will be more, I think, will be more helpful in figuring when and how we reopen our borders, no?
And can you just explain to us the difference between testing for the COVID-19 versus the antibody test? What's the difference?
Okay. The testing that we do and the testing that they're trying to develop is to check for the virus itself or pieces of the virus, the genetic material of the virus. So it tells you that you got a virus, okay? Every disease, every germ where your body come in contact with, you develop what are called antibodies, which are proteins of the immune system, okay? So dengue got its own by antibodies, TB, HIV, flu, all these germ-causing disease will have its antibodies. So that's what you test for. You test for the antibodies that your body would develop when they're exposed to that particular germ.
Yeah.
The problem we are seeing right now is that we don't know how this virus behave. We don't know how quickly the antibodies develop. We don't know for how long. We don't know if you're only going to be for 3 months or 2 years or forever. But that's the big difference. The testing that will test for the viral particle itself, the antibodies that will test for the proteins that your immune system make in response to the virus.
So one would test if I have the active virus in me, like I am currently carrying the new coronavirus in my body. That would detect it, the test that we're doing right now. The antibody test would mean that I have been in contact with that virus. I don't necessarily have it now, but I have had it before.
Right.
That would be the main difference.
That would be the simplest way you can say that.
Okay. And so
I mean, you could be more technical and say whether they want IgM antibody or want IgG antibodies.
Okay.
Those in the medical field will understand that a little bit better, but it can be too confusing for the general public to start to dissect that one. But just antibodies say that you were exposed to it and you have immunity against it
okay.
to a certain extent.
So you're saying a test like that may be helpful when we decide to open the borders to foreigners. Then we can know definitively whether someone has been exposed and perhaps, and I mean, does that mean that if you have been exposed that you're safer to enter the country?
Yes, that you've been exposed and you have a certain immunity.
Okay.
Also, quickly, I need to say, unless there's any approved, either by WHO or FDA, any approved rapid tests for the virus, then we can use that to perhaps decide how and when we open the country.
Yeah.
They're trying to work on it. They have given 15 different companies the task to do that. Everybody to try, it's a race to do it because, you know, the amount of money one company will make it for them one be successful and approved. And once that's happened, then we have to stand in line with the TUSE, and hopefully we get the amount of these point of care testing.
Yeah.
Let me get your perspective on this, because I know that, you know, people are at home, we're all watching, we're not medical professionals, but we have opinions on what's happening. And I know one of the concerns that people have had is when they hear that there is a reluctance to use a test that is being used in other countries, but not approved by the WHO or FDA. Talk to me about your perspective on that. How do you explain why for us in Belize it's important to rely on tests that have been approved by these bodies?
Yeah, that's a very good question, because even us in the medical community have debates and questions about the same thing. Because, for example, the testing that came out at China and South Korea were initially not okayed by the US, because we, the Belize, we think the US that we God. So if they not say okay, then we say no okay.
Yeah.
But definitely they also changed their stance that yes, the tests out of China and South Korea are valid, and they themselves, they bring in, you go hear Governor Cuomo from New York and the Bali from New York, Patriots send their own plane go get kits from South Korea. That first was not allowed, but now they're allowing it because it's valid. So we have to try to access kits from either of these places directly, and not wait for donations from Cayman and the States. And even WHO has its problem in its integrity. I mean, you hear all of the conspiracy theories that's happening with WHO and PAHO. So yes, we appreciate the help and give away, but we also have to use our brains and research and say, you know what, we need 50,000 kits from South Korea or 50,000 kits from China. We check, and get the better accepted ones. But no expect that we can get it from the States, from the US.
Not anytime soon.
Yeah. And looking, I mean, other areas that we need to develop during this time. So again, I want to be clear, 3 weeks, no confirmed COVID-19 case. It doesn't mean the end of us facing this pandemic. So it's really important that we kind of get our house in order to prepare to live with this until there is accessible treatment or accessible vaccine. What are some of the other areas that we have to critically build upon during this quiet time?
Well, when I participate in this discussion, and we also have medical conferences on a daily basis that was organized by the Ministry of Health, Dr. Hidalgo and Arriaga and myself. Every 2 o'clock every day we have one scientific presentation about something about COVID. Yesterday, for example, about the X-rays, how your X-rays will look, how your CAT scans will look. So every day, thankfully, And I even telling this as something where we need for continue all the time, even when COVID go fire. We discuss what else, no? We have to, especially us in Belize City, we have to stop think selfishly that Belize City. We have to look out for people in Punta Gorda, in Dangri, in San Ignacio, in Mapan, in Cayo, in Orange Walk and Corozal, so that they also can be prepared or better prepared as how you would see be reflected here in Belize City. We need to get perhaps like a PCR machine for each region, so the turnaround time can be less. We have to get people trained. In other words, what this COVID has done to us, if we were to find a silver lining, is to uncover, unmask, peel away the deficiencies, especially in our healthcare system.
That's
something
true.
I could talk about. I mean, anybody could talk about other deficiencies that they've seen, economically, financially, the agriculture, the cattle, everything needs to be looked at over again. But definitely on the healthcare system, we need to get a really serious look from competent people. And say it again, and I want to say it, and I want my colleagues to make us say it, we need to have the leadership in the Ministry of Health have a health background. Oh man said, I'm tired already. He need help. Okay, we need to select better leaders. We need to demand more as Belizean people, so that when COVID-21 comes, in a better position. We perhaps would not be in all the perfect position, because you never know. But definitely, this serves to help that we need to plan for the very near future and properly.
Absolutely important. All right, well, I think that's a good point to close off on for today. We appreciate you sharing your insight, especially when it comes to, I think what collectively everyone is seeing, which is we need to test more, we need to know more about where we are, and we got to get prepared for that second wave. Thank you so much for joining us.
Thank you, guys.
All right. Stay safe. And there we have. That's
Bye-bye.
a conversation with Dr. Fernando Cuellar. A number of interesting bits of information coming out there. And so we want to thank him for sharing in that conversation in our COVID-19 update. We're going to go ahead and take a break. And when we come back, money is tight.
Money management,
but it's probably even more important to manage when it's tight. So that's going to be our conversation after the break. Please stay tuned.
COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.